Spring 2020. It's been almost 2 years since people supported healthcare workers like this. Support many providers feel devoid of now. One Legacy Health nurse, who asked to remain anonymous, told KGW, "We feel forgotten, devalued, and taken advantage of. We are exhausted, working in unsafe conditions, short-staffed, and with very low morale." Those feelings, the nurse tells us, are exaggerated by this new COVID guidance policy. Legacy Health sent it to employees on Friday. It says employees who test positive for COVID can now come back to work 5 days after the start of their symptoms if those symptoms are mild enough to be controlled by over-the-counter medication. In short, employees who have COVID and are still symptomatic can now treat patients. With staffing shortages, Legacy Health officials say it's a no-win situation that led them to a tough decision.
We put our staff safety on par with our patient safety.
Legacy Senior VP and Chief Medical Officer, Dr. Seth Podolsky.
We are increasing risk tolerance to be able to care for the folks that so desperately need it. If we don't do that, we're going to find ourselves in crisis standards of care much faster as a region.
As it stands, many healthcare systems are working under contingency standards, which under CDC guidelines allows healthcare workers with COVID who don't have symptoms to return to work after 7 days with a negative test, or fewer days without a test if there are staffing shortages, something the public may not be aware of.
Suggesting that healthcare providers may indeed be symptomatic after having tested for COVID. How do you plan to disclose that to patients?
So we don't have any current plans to disclose. That could change. I don't know of other health systems in our region, Catherine, or the country that are doing that. Again, because what we know about the highly transmissible nature of Omicron.
Legacy and hospitals nationwide are facing a workforce slashed by illness and understaffing. At the same time, they're treating more people. In California, state health officials just announced hospital staff who test positive but don't have symptoms can also continue working. Rhode Island and Arizona have similar guidelines, and the list is growing.
Nurses are very concerned.
Kevin Mealy is with the Oregon Nurses Association, a union that represents many nurses in Oregon, although not those at Legacy. He says their concerns extend well beyond Legacy's policy. He points to the CDC's 5-day return to work without a test guideline. Those changes followed studies that show while Omicron may spread more quickly than other variants, it may also produce milder symptoms. However, the CDC also notes that even after 5 days, around 30% of people remain infectious.
And so when you take a nurse or frontline provider from being part of the solution as a caregiver and turn them into part of the problem as someone who now has COVID, you've really exponentially worsened the overall problem.
They're short-staffed and they're so overloaded by patients. Do you think those are reasons to continue with this line of thinking?
So there are more steps to limit the exposure of the healthcare workforce and prevent them from getting sick to start with, before demanding that they work sick.
Neely says those steps should include improving internal testing and exposure notifications, limiting hospital visitors, and requiring N95 masks or equivalent across the board.
Hospitals are the place we go to get care and to get well. We don't want it to be a place that continues the spread of COVID-19.
Catherine Cook, KGW News.